is, again, that there are blackout spots in the country. That some trends don't get picked up by the media because they're not understood. So you'll see a story reported. I mean, I'm sure a lot of you have had this experience of seeing a story reported and it's virtually unrecognizable in terms of what actually happened. Very often, mainstream media does not really understand what it is that's behind a story. And so we have to reinterpret what it is that's gone on behind a story. We'll hear a story about some crazy, oh, I heard this great one the other day, I read it, about a guy who was a founder of an organization for substance abuse. And his board and he had gotten into a kind of a wrangle about the future of the organization. So he decided to set up another board and fire that board. But that board didn't want to go away. And so somehow one day, both board presidents ended up in the offices at the same time. And the police were called. And the founder was escorted out in handcuffs. I don't know what the end of the story is, but, you know, knowing how things happen in the sector, you know probably what it is that went on there, right? But it's of virtually no use to anybody. Number one, if the story stays in the region that it's in. And number two, if we don't put some interpretation on top of it. Like, guess what? If you find that there's a growing gap between yourself and your board, please pay attention to it. And don't go at it head on. Try to figure out how you're going to negotiate through this stuff. When we put that story up, and I think it was called The Founder and the Board, and something about, you know, the founder and the board and an arrest. Oh my God, the readership on that story was enormous. You know, I mean, because we all know that there's bits and pieces of that in every single one of our communities. We act that crazy sometimes because we care that much about what it is we're doing. But we miss a lot of stuff because of the way media covers and doesn't cover the sector. Here's how we've changed our business model. We used to be this quarterly journal, tried to be extremely rigorous. We pay attention, careful attention to research. We never ever, you know, give you information that we cannot uphold by research. Even if it is based on something else, we will go look at the research, make sure that we're telling you something that really holds water. When we started doing the Newswire, we started basically, I would say now, we probably publish quarterly, probably 50 times as much information, with the same staff, by the way. And we still try to maintain that rigor. Clearly unsustainable. Clearly unsustainable. I get up at 5. I go to bed at 11. I work entirely through that period of time most days, and that's crazy. Understanding that, we were thinking, okay, so what's, you know, what do we do about this? It's clear. Who knows what we do about it? What is it? We don't hire more staff. We don't have any more money.
Volunteers vet the information.
All right, here's the deal. In publishing, there is this new notion, which I love, because it fits all of my, you know, kind of organizing mentality. There's this new notion of collective journalism. And basically what that is that a publication acts as a center for the intelligence of the community that it's working for. And you are that community. So we basically will sit at the center and work with people out in the field to produce information. Opinion pieces, news pieces, full articles on new ideas and how they're being implemented. And we will make sure that that material passes muster and that the publication that we then end up with is much more diversely peopled and also is like really contains a much much larger piece of the intelligence of the sector. So the way we've been working is actually very old school. The way we will work sounds exhausting, but also extremely exciting. Because if nobody else covers this sector, you should cover this sector. You should tell the story about how it is that we're developing our new business models, how we're dealing differently with government, what kinds of new relationships we're getting into with philanthropy, and what we think the future will be. It's up to you to kind of develop that image, through whatever means, through M&A on the one hand, but please also think about contributing to the quarterly in terms of the intellectual content. So I'm at this point inviting all of you to just, as I'm wandering around here later in the day, give me your cards, give me a sense of what you're thinking about and what you might want to do. I know there's some frustrated writers and journalists among you. And I'm very serious that as much as possible, we want to make it a very open avenue between you and us in terms of developing the future vision of the sector and really documenting the hard work and the brilliance of what it is that we're doing even in this very complicated environment. I have a couple more minutes, and I just want to open it up for one or two questions real quickly.
There are microphones.
And there are microphones.
Good morning. Many of us in the room are working with people. We're providing services for people in need, for providing housing, transportation, employment, food services for young children, homeless, aging, people with disabilities. We're seeing reductions in state-funded provider services and for contracted services. I'm wondering, what have you seen that's been working? What great stories can you share with us from some other states, not Arizona and California, that tremendously reduced their budgets for services? But have you seen some things working?
I hope I've got the state right. Recently, I think it was in New Jersey, a bunch of people with mental illness and families of people who had mental illness showed up in front of the governor's mansion. Again, very old school. Somehow it turned the situation around. The funding was replaced. I hope I've got these facts right. Here's an interesting model, though. In Texas, one of the things that I've noticed is that the funding for mental health has been reduced pretty disastrously in a lot of states. It's just a place where people, I feel like maybe they feel there's not enough of a constituency to worry about. But in Texas, the Hogg Foundation decided that it was going to put an enormous amount of money into advocacy on mental health issues. And so when it saw that budget beginning to reduce, it stepped up and it said, we're going to put money into advocacy on public policy in this area. I think philanthropy has a responsibility to note when the massive amounts of money, which really in a lot of cases dwarf what philanthropy can do, the massive amounts of money at the state budget level begin to be reduced. They've got to start to put some money into advocacy to make sure that there's a voice there to try and prevent that from happening. So that's what I mean. I think those two examples are what I would call to. There's been some minor saves. Overall, it's a pretty desperate situation, and people are choosing between necessary things.
Good morning, thank you for being here.
Do you have a program set up in the state now, an advocacy program to help you to work with that?
I'm a new member, I don't think we do.
Do you? No? No. Okay. We're about to print an article. We've printed a couple of articles before.